Welcome back to my channel Kineticare. I'm Dr. Abir Ali, and today we are starting an important topic. Lower limb anatomy. Chapter 1 Bones of the lower limb. This lecture is very important for DPT, MBBS, and physiotherapy students, especially for exams and Viva. Introduction. Let's start with the introduction. The lower limb skeleton is specially designed for weight-bearing, stability, and locomotion. Unlike the upper limb, which focuses on mobility, the lower limb is built for support and strength. It helps us in standing, walking, running, maintaining posture. Also, the lower limb is attached to the axial skeleton through the pelvic girdle, which transmits body weight to the legs. Hip bone. Now let's talk about the hip bone, also called os coxae. Each hip bone is formed by fusion of three bones, Ilium, Ischium, Pubis. These three meet at a cup-shaped cavity called the acetabulum, which forms the hip joint with the femur. Important features you must remember. Iliac crest right pointing arrow easily palpable. ASIS right pointing arrow important clinical landmark. Ischial tuberosity right pointing arrow sitting bone. Pubic symphysis right pointing arrow joint between two hip bones. Function. Transfers body weight. Provides muscle attachment. Exam tip. Acetabulum equals socket of hip joint. Femur. Next is the femur, the longest and strongest bone in the body. It has proximal end, shaft, distal end, proximal end, head right pointing arrow articulates with acetabulum, neck right pointing arrow common fracture site, greater and lesser trochanters right pointing arrow muscle attachment, shaft, slightly curved, has linea aspera, distal end, medial and lateral condyles, patellar surface, function, transmits body weight from hip to knee. Clinical point. Neck of femur fracture is very common in elderly. Patella. Now the patella. It is the largest sesamoid bone in the body. Location. Inside quadriceps tendon. Function. Increases efficiency of quadriceps. Protects knee joint. Surfaces. Anterior right pointing arrow rough. Posterior right pointing arrow smooth. Important. Helps in knee extension. Tibia. Next is the tibia. It is medial bone of leg. Main weight-bearing bone, proximal end, condyles right pointing arrow articulate with femur, tibial tuberosity right pointing arrow ligament attachment, shaft, shin bone, subcutaneous, distal end, medial malleolus right pointing arrow ankle joint. Clinical, easily injured due to subcutaneous position. Fibula. Now the fibula. Features, slender bone, located laterally, does not bear weight. Function, muscle attachment, stabilizes ankle. Parts. Head, shaft, lateral malleolus. Exam tip. Fibula equals support, not weight bearing. Foot bones. Now let's discuss the bones of the foot. Total equals 26 bones. 1. Tarsals, 7. Talus. Calcaneus. Navicular. Cuboid. 3. Cuneiforms 2. Metatarsals, 5. Numbered I to V. 3. Phalanges, 14. Great toe right pointing arrow 2. Others right pointing arrow 3 each. Functions. Support body weight. Maintain arches. Help in walking. Important. Calcaneus equals largest tarsal bone, heel, clinical anatomy. Now some important clinical points. 1. Neck of femur fracture right pointing arrow common in elderly. 2. Patellar dislocation right pointing arrow mostly lateral. 3. Tibia injury right pointing arrow due to subcutaneous position. 4. Ankle fractures right pointing arrow involve malleoli. 5. Flat foot, pes planus, right pointing arrow arch collapse. Conclusion. So today we covered hip bone, femur, patella, tibia and fibula, foot bones. These bones are essential for movement, stability, and posture. If you found this lecture helpful, thumbs up like the video. Push pin subscribe to Kineticare bell turn on notifications. Next lecture will be hip joint anatomy. Thank you for watching.